Well, we can't hide behind a Hippocratic oath that's 2,500 years old. Hippocrates never envisioned AIDS, neonatal intensive care units, crack cocaine babies, artificial hearts. But those are our realities, and we have to deal with them.
The best way to deal with them may be to do what the state of Oregon is doing. Computerize a list of which diseases they can afford to treat and which ones they can't.
I'm Mike Wallace.
I'm Willie Safer.
I'm Ed Bradley.
I'm Steve Croft.
I'm Leslie Stahl. Those stories and Andy Rooney tonight on 60 Minutes.
Yes News Weekly Magazine will...
Like the weather, everybody talks about health care, but nobody seems to be able to do anything about it, except for the state of Oregon, which has a plan to provide basic health care and health insurance to virtually every man, woman, and child in that state. It's now past the talking stage and ready to go, if it gets the approval of the federal government, which will have to put up some of the money to help fund it. But before it does that, the government will have to agree to change federal Medicaid rules in that state. The debate has been called the single most important debate on the future of health care in the United States. How does the Oregon plan work? Well, the man who came up with the plan and sparked the debate, John Kitzhaber, says it's based on a very simple premise. We as a society simply can't afford to provide unlimited medical care to everyone.
Well, we can't hide behind a Hippocratic oath that's 2,500 years old. Hippocrates never envisioned AIDS, neonatal intensive care units, crack cocaine babies, artificial hearts. But those are our realities, and we have to deal with them.
Kitzhaber is the president of the Oregon State Senate and the principal author and sponsor of the Oregon Health Plan. When he isn't a politician, he is Dr. John Kitzhaber, an emergency room physician.
You see a woman who comes into the emergency room in labor, having never seen a physician or a nurse practitioner in her prenatal care. She produces an infant who's going to suffer the rest of its life. It's going to cost pennies to prevent that kind of thing.
Kitzhaber's combination of political savvy and medical credentials made him the natural leader in the effort to create the Oregon Health Plan.
People want leadership. People want to be able to make choices. They know choices must be made, and what they really want is they don't want to get sick. They're more concerned with not going to the hospital than what happens after they get to the hospital.
Roughly 80% of the people in the state of Oregon have at least some health insurance. They either get it at work, or they've got private policies, or qualify for Medicaid or Medicare. But 1 out of every 6, 450,000 people, have no coverage at all. They are mostly working poor and middle-class families that make enough to live above the poverty line, but not enough to afford health insurance.
Under the plan, every business in the state of Oregon will have to provide health care insurance for all of its full-time employees and members of their family by the year 1995. And for those people who don't have jobs, Medicaid benefits will be extended to everyone in the state living below the poverty level.
What kind of coverage? Well, it wouldn't provide everything for everyone. Kitzhaber's plan would ration health care, but still provide a basic minimum guaranteed package of health services for everyone. That package would be the minimum standard in Oregon for private as well as public health insurance.
We've chosen this to be accountable and say, okay, this is the amount of money we have. These are all the people in Oregon who deserve access to the system. How can we spend those dollars in a way that's going to make them healthy and keep them healthy? And that means making some hard and difficult choices.
To make those choices, the Oregon legislature created this group, the Oregon Health Services Commission, made up of doctors, consumer advocates, social workers, and union representatives. For the last 2 years, these unpaid commissioners have held nearly 50 public sessions around the state, like this one, trying to find out how much and what kind of medical care the people of Oregon want and need. And the commissioners have taken a hard-nosed look at health care.
Let's get rid of this pretense that we can do everything for everybody, because we haven't and we can't.
I call Oregon's plan a dose of reality.
The commissioner's mission was clear, to set some priorities. So they made up a detailed list of 709 medical conditions and their treatment, and then they ranked them in terms of importance, cost, and effectiveness, beginning with the most urgent and treatable.
I can remember sitting there and watching it come off the computer one day and reading that list as it came out, and it was like eureka, a list that made sense, it was logical, and it could be defended. And that's the list we have now.
What is number one?
Pneumonia.
It's probably number one on the list because it's life-saving, it's fairly inexpensive to treat.
And what does the commission think is the least valuable? Number 709 on the list?
And certainly that's a newborn infant born without a brain. And the treatment for that unfortunate child is comfort care until the baby inevitably dies.
The commission sent the list to the Oregon legislature, which decided that the state could afford, if it got federal matching funds, to pay for the first 587 treatments for the next 2 years. The coverage would include everything from chemotherapy and open heart surgery to abortion on demand and maternity and dental care. There is a heavy emphasis on preventative treatment, like mammograms for the early detection of breast cancer. What's not covered? Everything below number 587 on the list. Example, number 600, breast reconstruction after a mastectomy.
We did not consider that that was so important to society as a whole that state resources should be directed towards that.
Also not covered, number 670, laryngitis.
Gets
better on its own.
You will be able to go to the doctor and find out that indeed you do have laryngitis. That diagnostic visit is covered.
Many of the medical conditions below that 587 cutoff are inevitably fatal, and the commission says aggressive and expensive treatments would be futile, like the very last stages of cancer and AIDS. But the early stages of those diseases are covered.
The preventive services for early diagnosis of an HIV infection are covered. AZT, the drugs that would be required, are covered. Indeed, at this point in time, the best care for them would be hospice and comfort.
Comfort care ranks very highly on the list. We felt that it's important for those people to provide them comfort, relief from pain and suffering, and let them die with dignity.
One of the more controversial choices below the line is number 708. A premature baby weighing less than 500 grams, or 1 pound, will not be kept alive with state funds. The commission says those infants have almost no chance of survival, and even less chance for what the commissioners call a worthwhile quality of life.
So you're making life and death decisions for people.
Yes.
Dr. Rick Fulroth is a neonatologist who trains other doctors in the delivery and care of premature babies. Dr. Fulroth is opposed to the Oregon plan.
About 10% of those babies will survive at that weight or under that weight. Many of them will have serious medical problems. But let me tell you that what kind of things we experience here. Baby's born, it comes out. A little child looks up at me, sometimes with their eyes open. You know, right about 500 grams is when their eyes begin to open. My house staff turns to me and says, Dr. Fulroth, what do we do? And I say, we resuscitate this baby. Can you walk away from this baby, say, you didn't make the cut, you were 708, I'm sorry, goodbye, and walk away and leave it there so it can slowly turn blue, slowly begin to go shock?
Choices have to be made. And this issue is not going to be resolved until someone has the guts to stand up and start looking this issue in the eye and making some choices.
How much does it cost to treat a baby under 500 grams?
Anywhere from $250,000 up into the millions. You can provide prenatal care, screening care for tens of thousands of people. You can provide put money into the Head Start program. You can keep kids off drugs. You can prevent women from becoming addicted to crack cocaine. I mean, we're chasing our tails here.
Kitzhaber says health care is already being rationed in America by the federal bureaucracy under the Medicaid system, which in theory provides health insurance for the poor. In reality, it provides almost unlimited and expensive health care to some poor people and nothing to others, creating, Kitzhaber says, 2 classes of poor people.
The deserving poor, the people who fit into a federal category. Then there's the undeserving poor, which is this growing group of people who just don't qualify for anything. They fall through the cracks. And to put that into perspective, that means a family of 3 making more than $5,600 a year is considered too wealthy to qualify for publicly subsidized health care in many parts of this country, which I think is obscene.
There are 37 million of them, people who must go to an emergency room every time they get sick.
I have an emergency. I need to see someone. And so I've come here because I can come here. I don't have health insurance.
I'm here because I have no health insurance.
I don't know how long I will have to wait until I receive some service from the hospital.
These people must wait, and making people wait, the inconvenience, has become another way of rationing health care. Dr. Patrick Conell runs the emergency room at Highland Hospital in Oakland, California. Like John Kitzhaber, he says the cost of medical care would go down if everyone had regular access to a doctor.
if people have access to health care or regular physicians, you won't end up having to see them in here when they have the heart attack, when their kidneys finally fail, when they finally are going to cost you a lot of money.
The Oregon legislature has already passed all of the bills necessary to make its list the law, and it set aside the money, $34 million in additional funds to cover everyone. But before the plan can go into effect, it needs the approval of the federal government to change Medicaid guidelines in the state of Oregon. Because in order to provide basic health care to everyone, some people currently receiving Medicaid would have to lose some benefits. The benefits below number 587 on the list, the ones not covered under the Oregon plan.
That's a reverse Robin Hood, isn't it? To take from the poorest of the poor to give to the poor? That's not the American way.
That idea doesn't sit well with some in Congress, like Representative Henry Waxman, who heads the House Subcommittee on Health and the Environment. Waxman, a protector of Medicaid, is one of the people who could give Oregon the approval it needs.
What bothers me is the idea of, depending on how much money they have, deciding that they're going to start denying these people some of those services in order to make up for the cost for other services for other people.
I would defy them to explain to me what service we haven't covered below the line that would justify denying access to everything to 65,000 women and children.
Those 65,000 poor women and their children who Kitzhaber wants to include in his health plan would all get coverage up to number 587 on the list. Under the current system, they're all excluded. Nevertheless, Congressman Waxman is not impressed.
The heart of this is they want an arbitrary number, depending on how much money they're willing to put into medical services, to determine whether you as a sick person who happens to be poor will get that service or not. And I don't think medical care should be based on that. It should be based on the individual. Some therapy may not make sense for one individual, but would be life-saving for another.
We can no longer avoid the reality that the treatment decisions we make on some individuals have a direct impact on the ability of other people to get care. And you cannot build social policy strictly on the exception.
The Catholic Church and the Children's Defense Fund both oppose the Oregon plan because they think it endangers benefits that are currently guaranteed to the poor and especially to children by the federal government. And Congressman Waxman told us he's opposed to the Oregon plan because the state refuses to guarantee that it won't cut back health care benefits and move the cutoff point on the list above 587 if it's faced with economic hardship sometime in the future.
Well, that's kind of an amusing argument. That argument's like saying because we can't guarantee the Medicare appropriation next year, we ought to discontinue Medicare this year, even though we have the resources to do it.
Kitzhaber says making the list the guideline for all health insurance in the state, combined with letting 450,000 uninsured new people into the system, will make it political suicide for legislators to cut back on the benefits.
Why not give them a chance to come up with their own solution?
Well, they can come up with their own solution, and they can come up with their own dollars to pay for it. What they want are federal dollars to use anywhere they want.
You've stuck your foot right in the middle of some really explosive political issues, just by making a list.
Yeah, just by making a list, we've basically, what we've done is articulated what's going on right now. We just have the intellectual honesty to admit it. Those choices are being made every day in America. I mean, you know, Americans are dying today. We can't prevent Americans from dying. It's not a perfect world, but we can create a system where we invest our limited resources in a way that keeps them healthy and keeps them out of the healthcare system in the first place. And I'm a great believer of the old Chinese proverb, you ought to pay doctors while people are healthy. That's not the way our allocation system works right now.
While Congressman Waxman and Dr. John Kitzhaber disagree about the Oregon plan, they do agree on one thing.
We need comprehensive national health care reform in this country. This is not a substitute for that in any way, shape, or form. I've got a constitutional obligation to try to provide the best care possible to the people I represent in the state of Oregon, and I can't wait till the year 2001 till Congress gets its act together.
Faced with Congressman Waxman's opposition, the state of Oregon decided to go around Congress and go to the White House and its Department of Health and Human Services for permission and the funds to implement the plan. A decision is expected later this month, but it's safe to say if the decision is yes, it will be a popular one with doctors, insurance companies, consumer groups, and labor unions in the state.